If you're thinking about wearing hearing aids, or you already wear them, you may be worried about one thing. Am I going to make my hearing worse by using them? I hear this question all the time in my exam room, and it's a very real fear, especially if you've noticed your hearing changing over time and you're wondering whether your hearing aids are helping or actually hurting. So let's talk about the truth. Can wearing hearing aids damage your hearing or make it worse over time? The answer surprises a lot of people. This fear didn't come out of nowhere. Most people are thinking about muscles. We're taught that if you don't use a muscle, it gets weaker. So it's logical to assume hearing might work the same way, but it doesn't. Hearing loss is not a muscle problem, so hearing aids don't weaken anything. They don't replace your ears. They restore access to sound your brain hasn't been getting clearly. And that difference matters more than you think. So if hearing loss isn't about weak ears, what do hearing aids actually do? They don't take over your hearing, they don't replace your ears, and they don't make your brain stop working. What hearing aids do is improve the quality of the sound signal before it reaches your brain. When hearing loss is present, sound still gets in, it's just distorted, incomplete, or missing important details. Your brain is forced to work harder to fill in the gaps. Hearing aids clean up that signal. They make speech clearer, not louder. They restore access to sounds your brain was already trying and struggling to interpret. So instead of your brain guessing all day, it can finally hear the information it needs. Here's the part most people never hear. If anything can make hearing feel worse over time, it's not wearing hearing aids when you need them. When the brain stops receiving certain sounds, it slowly becomes less efficient at processing them. This is something we call auditory deprivation, and it's one reason untreated hearing loss is linked to increased listening fatigue, difficulty understanding speech in noise, and a faster decline in speech clarity over time. Hearing aids don't cause that. They help prevent it. This is where people get confused. Some people say after wearing hearing aids, everything sounds worse when I take them out. That doesn't mean your hearing declined. It means your brain remembered what clear sound feels like again. Once you experience clarity, muffled sound feels more obvious. That's not damage, that's contrast. This is important. When properly fit and programmed by a professional, hearing aids do not damage hearing. Modern hearing aids have output limits, compression, and safety algorithms to protect your ears. Problems only happen when devices are over-amplified or poorly programmed. That's why evaluation and follow-up matter. So here's the clear answer. No, wearing hearing aids does not make your hearing worse. In many cases, it does the opposite. They help your brain stay connected to sound, speech, and the world around you. And the earlier they're used, when appropriate, the better the long-term outcome tends to be. If you want to understand what hearing aids are actually doing and what they're not, watch the next video on how hearing aids really work.